Hurricanes are large tropical storms that form near the equator and travel across the warm waters of the Atlantic. Hurricanes can grow to be more than 500 miles across and can pack winds in excess of 100 miles per hour. Hurricanes cut paths of destruction thousands of miles wide and have caused billions of dollars in damage. As residents of the Tampa Bay area, we need to recognize that we live in an area that is susceptible to being hit by a hurricane. Along with making sure you have enough bottled water, batteries, flashlights, and canned food, you should also ensure you are prepared to offer first aid in the event you or a loved one becomes injured during a hurricane. After viewing this video series, you will have the information you need to offer first aid for 5 injuries that are common during and after a hurricane, including fractures, eye injuries, concussions, shocks, and near drowning. In this segment, I will discuss how to properly offer first aid to someone who may have suffered a concussion during a hurricane. Remember, after a hurricane, it may be hours before trained medical professionals are able to access you or your family due to high demand for medical attention, storm debris, and localized flooding. If this is the case, what you do in the first minutes following an injury is vital. However, these instructions should not take the place of professional medical care. You should always seek medical attention as soon as you are able following an injury. Concussions are mild head injuries that are caused by the brain being rattled around in the head. This causes a brief short circuit. During a hurricane, a number of things can cause concussions, including car accidents, falls, and flying debris. When you're approaching someone who may have a concussion, approach slowly and speak softly. Ask them if they're okay, and introduce yourself. Check for common concussion symptoms, such as headache, vomiting, visual disturbances like double vision and seeing stars, or cognitive symptoms including confusion, disorientation, difficulty focusing attention, or post-traumatic amnesia. Then, if you still suspect a concussion, check the head for cuts, bumps, and bruises. Also, check the eyes for unequal pupil dilation. The presence of any of these suggests a concussion is likely. Help the person slowly to their feet. Seek medical care at the nearest hospital, medical facility, or first aid tent.
Now it's time to test your knowledge on treating a concussion. When treating a concussion, what is the first step you would take? If you answered assess the victim, you are correct. And the next step is to check the head for cuts and bumps. And the third step? To check the pupils. The next step is if you answered ask the victim questions, you are correct. And the final step of treating a concussion is to seek medical aid.
The video you have just seen provided a basic understanding of the steps necessary to address an injury that may occur during a hurricane. Review these steps at the beginning of each hurricane season and practice them with your family or friends. Being prepared and taking precautions before the storm arrives should still be your top priority, but accidents may still happen, and by being prepared, you will be able to offer assistance in a critical time. Remember, these instructions are not intended to take the place of professional medical care, and you should always seek medical attention as soon as you are able following an injury. For more information on current hurricane threats and what you can do to be prepared, please visit the National Oceanic and Atmospheric Administration's website at www.nhc.noaa.gov.